So if I can ask you first of all, what's your name?
I'm Janet.
And Janet, whereabout do you live?
I live in Preston Park in Brighton.
Okay. And what do you do for a living?
I'm a retired teacher.
Right, a very good teacher as well. All my children have been over the years. Yeah, remember you fondly. So Janet, just a few things we're going to just ask you about your dental treatment. You were faced with the decision of replacing a few teeth, and an interim measure was giving you a plastic denture, wasn't it, which you had to do. So if you can just tell me how you felt about having to wear a denture.
When Nigel first suggested the denture, I was really very upset, quite depressed about it, because I thought that's a very invasive thing in my mouth. And actually the reality of it, it was all right, but it was just cumbersome, it was awkward, I was very conscious of it when I was speaking and eating, and I just hated the whole thing of having to take this thing out at night. It was not a pleasant experience for me at all, and Nigel was very supportive about the whole thing, about what I could do to get rid of it.
You were kind of desperate to get rid of it, weren't you? I really didn't like it. So from the quality of life point of view, I mean, how would you have felt if you'd had to wear something like that from then on? I
wouldn't have liked it, because it was quite a big denture. It was 4 teeth on the upper palate, so upper jaw. So it was very cumbersome, and food would get stuck in it. I was very aware that my speech wasn't as clear as it might have been. So, and smiling was an issue as well. From all that sort of social side was I just felt much more conscious of that, and a bit more awkward, really.
Yeah. And a lot of other people have sort of said, oh, the other thing I feel a bit about is just the sort of feeling it's like an aging process almost. You remember our parents having
that was the depressing part, because I can remember coming out of the surgery and going home and saying, it just makes me feel so old that I'm going to have that kind of procedure. And I was hoping, well, Nigel had suggested implants, and I thought I might have to go down that route eventually, but we had to do the denture to start with. But it made me realise I didn't want that.
No, not as a long-term solution. Quality of life would diminish. I certainly wouldn't want to do one. And so when we looked at implants, there's various systems to do, and the system we use for you, we describe it as minimally invasive, or it's quite straightforward. It's much quicker. What some patients worry about is it's going to take months to do, 6 to 9 months. It's going to be quite a surgical procedure, but if you just tell us a little bit about how long it took, Janet, roughly.
It was very quick, because once we decided that was the better option for me. So we first of all had to just do some preparatory work, and then the gums settled. So I had these implants put in, and then they had tops on them, and then my denture went back over the top. That was a little bit tricky, but I got used to it because I knew the end was in sight. So I think they were in for about 10 or 12 weeks.
So only 3 months.
Yeah. So when I came back in the January and Nigel fitted the finished product, as it were, I was just delighted. It just felt so different. It took a bit of adjusting, because I got used to it. Well, I got used to it, but because it looked so different. And my mouth felt different, and I felt much more confident about eating and smiling and all that kind of stuff. But you made some adjustments, and I'm really happy with it. It feels like I can eat things as normal. I can talk. I've got no sort of issues with that. So socially, I feel a lot more confident. Yeah, my confidence back again. So
absolutely, it makes a big difference, doesn't it? I mean, I would struggle to wear a denture like anybody else would do, and I'd hate to think it's a long-term solution. And it's like getting your life back, really, in a way, isn't it? You can go out again, you can socialise, you're not sort of hiding away a bit.
I think the thing with the denture is as well, because it's not fixed, so you're always kind of conscious that it sort of might be moving about or not fitting. And the longer I wore the denture, the looser it became, obviously. So that became more of an issue. But now I don't think about it.
No,
I'm looking after it. I'm looking after the implants, but it just makes such a difference to me. I don't regret it at all. And if you in that position, then I would say go for it, because it wasn't painful. In fact, I've had more painful treatments in the past, but it wasn't invasive, and I just feel that.
You didn't have that gum surgery that a lot of patients are a bit anxious about, where the gum is cut to put the implants in, but we did these tiny little puncture holes to put them in, so it saved you having all of that, because it's that tends to be the sort of fat face, swollen.
No, I had nothing after the initial procedure. Well, I was obviously a bit of discomfort, but it was only anything you'd expect, but no swelling of the face, it wasn't painful. I think, by the next day I wasn't aware of it but the denture was back in again.
Yeah.
And any follow-up things, I think we had some little problem with the screw caps on them, but that was quickly fixed. But as to pain or discomfort, no, there wasn't any. And then, so when the final implants were put on, it was just
so you're
fantastic.
now able to go out again socially,
I
aren't
am.
you, Janet? We
Yeah.
see you out
Yeah,
everywhere all the time
everywhere.
now.
In fact, I've got a couple of other gaps that I think I might have the same
Address
thing
in
done
time.
eventually.
Okay,
Yeah.
absolutely.
So,
Okay, Janet, and would you have any problem recommending
no.
patients to have treatment done this way in this shorter, less invasive procedure?
I would recommend it because for me, it's just made. I was very fed up, very depressed about this whole denture thing, but now I feel much happier about the way that I am, and I can just be confident about speaking, eating, just being with people. Really, I was very conscious of the denture.
Yeah, Helen's hygienist said you were a little bit sort of depressed about it one time when you came in, but you're back on top form again.
I am on top form, yes.
Okay.
So I'm very pleased that Nigel recommended it, and he taught me through it, so I knew exactly what was happening at each stage, and that's helpful too.
Good.
So
Thanks, Janet. That's great. It's a big help.